Hello everyone, my name is Matthew Akwego, a Lone Star College student. I'm here to inform you about a disease that has been out there but not known by so many. It's called celiac disease. It's ravaging largest population in the entire world. It affects the small intestines of human beings and it has general symptoms that comes with it. The impact on patients and then there are recommended treatment options, even though there are general conceptions that the disease has no cure. But the good thing is there are recommended options where you can get treatments. Celiac disease is an autoimmune infection on the small intestines, like I've mentioned. It comes from the food we eat. Food that contains gluten. Actually, the disease is caused by gluten that releases protein called autoantibodies that attack healthy cells. That means when gluten releases those proteins, it affects the healthy cells in your body, and that causes severe illness. And the disease is hereditary. That means even if you don't eat food that has gluten, you can also inherit it if it is available in your family lineage. And so um, it has its own symptoms that manifest as a result with every patient that it comes across. So it affects both young and old. With the symptoms of weight loss, depression, fatigue, and diagnosis of nutrient deficiency, and all other comes with so many abdominal pains that comes with it. And so, giving a thought to it in form of introduction, we know that we have so much in the world to deal with. Soon as you end up here on earth, you know you have so much to deal with. Then come to think about something that you don't even deserve and yet now telling you is out there. Yes, celiac disease is out there. But the good thing is there is cure for it. So that is why I'm here to let the entire world know it's a gospel now that we should all be aware of it and carry it across so that we can wage war against it and become victorious. So I'm very sure at the end of this speech, we will be well informed and know what next necessary step to take to get it uh, across our way, medical health. Celiac disease is a persistent digestive and immune disorder that damages the small intestines. It is prompted by eating food that contain gluten. I have said so. When you eat this food, it goes all the way to secrete that protein that really affect all the good um, metabolism in your body, and it goes like that. Sometimes, according to Mayo Clinic, that made some publications, medical publications, something is called celiac sprue or gluten sensitive interferometers. And so, um, definition, different ways of interpreting it, but it all fall down to gluten that is found in the foods that we eat. The signs and symptoms varies, but it includes weight loss, abdominal pain, diarrhea, fatigue, nausea, and vomiting. And this varies between adults and children. So when it comes to children, they have gas, constipation, nausea, and vomiting. And they found pale, sometimes they have smelling stool and chronic diarrhea. So all these things, once you have the symptoms, you need to consult your doctor and to get treatment. These are other approaches, organic approaches that are available out there that doctor will make recommendations according to your diagnosis. So follow up with this. The diagnosis procedures um, also depends on your own level of the severity of the illness in you. And so one of it is serology testing, SARD, this type of medical testing that looks for antibodies in the blood cell. If the level of certain antibody proteins are found high, that is indication that immune agents reacting to the presence of celiac disease, that shows positive. That way, doctor will advise you accordingly. Of course, you need treatment. Genetic testing, which arises as of genetics, and it goes through different levels of genetic testing, which includes molecular, gene panel, chromosomal tests, gene expressions, biochemical tests. These are various ways that test comes up, they be able to detect which level of gene that is causing it to get the infection into you. So here we are, how the celiac disease is contacted, which is part of what we had already talked about, eating of food that contain gluten and contamination of diet with gluten. That means some people are already on diet because they already are aware, but still, if that diet is contaminated, not well done, it becomes a big problem. Then, of course, we talked about inheritance, that is the gene, the family lineage, and those are various ways where you can contact it. Treatment measures and plans. There are so many remedies. Of course, you have to go through the dietitians, the doctors, to get appropriate treatment. And some of them involve vitamins and mineral supplements, pills, if the patient suffers severe anemia or nutritional deficiencies. But in cases where the digestive tract system has difficulties absorbing vitamins, injections might be the best option. So it is left with the doctors and to make adequate or appropriate prescription for a patient. So recommended foods, of course, we have to talk about how we eat. Every day we talk about dieting, but dieting is not just the issue. Every recommended food has to go in line with what is suitable in your body. So, but to avoid food that has gluten, you eat eggs, it's advisable, vegetables, most dairy products, fresh meats, fish and poultry. These are some of these foods. Also you have to read in between the labels to make sure they don't contain it, because some of them, even though they are within that line of recommendation, they still have gluten. So we have to be very careful about it. Foods to avoid. We talk about wheat, farina, malt, semolina, rye, barley, drum. Most of these foods are not known to most people, but now that we are getting informed, we have to actually go to the grocery stores, and when you are buying, be careful and read in between the lines and buy food that do not have gluten. And some of these categories, this list here will be of help to you. We're still talking about envelopes. Could you imagine that? Envelopes, Play-Doh, prescription on over the counter, medications. Could you imagine? So there are so many ways we can get it, but again, the doctor will always help us with the best prescription ever. But again, we still have to play our role to make sure we don't fall victim to this illness. Other remedies. The dietitians may recommend vitamins, mineral supplements, pills if patients suffer severe anemia or nutritional deficiencies. But in cases where the digestive tract system has difficulties absorbing vitamins, injection might be the best option. We had talked about this previously. So, removal of gluten from diet leads to a gradual reduction of inflammation in the small intestines. This is the recovery stage where if the uh, uh, diet placed in you or recommended for you is working, it helps you to recover speedily, and this which makes the patient feel better and ultimately reach a healing point. See, you may reach a healing point. That means it becomes a lifestyle in you. It is generally noted that children recover faster. Of course, their immune system are stronger. But when you are getting older, your immune system gets weaker. So we should be very mindful of that. So follow up with the doctor, and these are general advice given by every doctor treating this illness, celiac disease. Medication options, there are all options out there recommended by different doctors. Medication options, yeah, we've talked about that. So we are aware that it's not just any and anyhow medication, but medication that fall in line, appropriate for the level of severity of you suffering it. Even with the various treatment options available, patients must seek doctor's advice for appropriate treatment options to ensure speedy healings. That has been repeatedly said in the course of this presentation. So, um, in conclusion, celiac disease is a chronic immune-mediated enteropathy of the small intestines caused by exposure to the dietary gluten in genetically predisposed individuals, that is mentioned by Natalia in his publication. Um, Celiac disease infection on the small intestine causes prolonged health issues as it keeps the body from receiving all the nutrients it needs. You see, that is why it causes a lot of damage to the small intestine because it's already depriving your body of um, receiving better nutrients that you're supposed to receive. So we should be very mindful of that. So having known, become aware of this illness and the various options of treatment available out there, we must be very hopeful. Instead of just fall prey to it or giving up, now we have hope. Now we know the pathway. Even though if we contact it, we can still live our normal life peacefully as long as we keep complying. So I want to thank you for listening to this speech, and I appreciate you all. Go ye and propagate the gospel of celiac disease and let people know the various ways of treatment is out there. Thank you. Again, my name is Matthew.